there's different types of AI,
Yeah.
right? And so what's the difference between generative AI and predictive AI?
I think that's a really good question, right? And like, what is AI? Because you're hearing a lot of buzzwords. You hear
Yeah.
Gen AI, you hear chatbots, you hear agentic AI, foundational models. So let's start from the beginning and say, what is AI,
Yeah.
right? So AI is the ability to predict something's happening in the future. Number two is the ability to change that event in the future from that knowledge. And number three, which is the most important, is the ability to learn, right? Or to think, or the machine to think.
Machine learning, right?
Well, yes, that's a good transition to what I was about to say is, and so AI has all tools that are data science tools. So you have machine learning. Machine learning in and of itself is not AI. Natural language processing by itself is not AI. But combining a number of these tools or multiple MLs or multiple deep learning or neural nets together creates that AI, right? And that it has the ability to produce a product that changes a future event and has the ability to learn.
So like ChatGPT, Gemini, that's more Gen AI, generative AI,
so
right?
if we get to what Gen AI is, and we're very thankful to our friends at OpenAI and ChatGPT, because up to this point, right, people didn't really touch and feel AI, right?
Yeah.
And so for those of your viewers that have as many gray hairs as I do, right, there was the Netscape event of the internet, right? And so we believe that OpenAI and ChatGPT and generative AI is that same event for AI, because people can touch and feel it. So what is Gen AI?
Yeah.
Gen AI is a combination of natural language processing and natural language generation. So, you ask it a question, it interprets that question, and then goes out to a large language library and gets the information back. So what is a normal blood temperature or a blood flow? And it goes out and brings that back. What is the capital of Vermont? And brings that back. Or write me a term paper on who the best president of the United States was, and it will take information from that large language.
So in healthcare, Gen AI would be like an AI scribe. Would that be right? Or note summarization and things like that?
So that's more auditory AI,
Okay.
Because that's voice to text, and we've had that for a long time. So
Okay.
when you have ambient AI, you hear that a lot in healthcare. So
Yeah.
like it reduces the work for the nurses and the doctors because it transcribes that right into the notes of the EMR.
Yeah.
So that's actually natural language processing and voice to text,
Okay.
right? And then you could actually process that information because it's now text, and you can add that to an unstructured data model in AI.
Oh, and what about predictive AI? What's predictive AI?
So in predictive AI, that's a foundational model, right? So there's a difference between a foundational model and generative AI. So a foundational model is a prototype, or it is custom built to be able to use a number of tools, may that be machine learning, deep learning, neural nets, NLP, and it's put together in such a way that it processes information, and then when it's queued, it can give you a prediction based on the subject that you're looking for. So here at Renal, we're trying to look at like what is the optimal dry weight, right? And we have built that foundational model for dry weight, or for clearance, or for hospitalizations.
So in the setting of healthcare, how do you use predictive AI?
So we right now are at the conference for renal cell kidney disease. So we are predicting in the future 2 weeks, 4 weeks, 6 weeks, different predictions. So they could be hospitalizations due to fluid overload. Some people who say chest, tightness of chest, or challenge of breathing. General hospitalizations, readmissions, which are really important to the nephrologist. Dry weight, do we need to change the dry weight to keep them there? Mistreatments that don't have anything to do with it. So there's a number of those things that the licensed professionals can act on.
And then you're going upstream as well too, right? We're going upstream to CKD, right?
So we're thinking, hey, we have 800,000 patients in the United States that have dialysis. What could we do if we could predict transition in chronic kidney disease to prevent that transition into ESRD? Now, we're not going to prevent it completely, but we can retard that process.
Yeah.
So we've now moved up. We're at 50,000 lives, chronic kidney disease patients at a number of nephrology practices, and we can actually predict the transition of the stages. So 3A to 3B, 3B to 4, 4 to 5, and then the optimal start into dialysis. But also predicting home dialysis, which patients would be best at PD versus HD, or are they better off at the clinic?
Interesting, and I can imagine that's where the interventions come in, right? So if someone's a high risk going from 3A to 3B to 4, that's where you make sure you maximize ACE inhibitors and SGLT2s, GLP-1s,
Absolutely.
all these new fancy drugs. Those are the patients you should spend that kind of money on and use those kind of pharmaceuticals.
Absolutely, because you're actually going to get the bang for your buck because you're laser focused on that. And we're giving you a hyper-personalized prediction that for this patient, we believe they should have this combination. But it's always up to the nephrologist at the end of the day because they are the licensed professional. We're just giving them all the information in the future for them to make the best prediction.
Awesome.
But one last part I think that we should talk about with generative AI is, so you have the OpenAI and ChatGPT, but no one's talking about the small language models. So we have small language models that are specific for renal, kidney, CKD, or cardiovascular, or diabetes, that don't have the hallucinations and the downsides of the large language models, because we have a small language library that's curated for that medical disease state specifically.
What?
More to come on that one.
All right, nice seeing you,
See
man.
you later, bud.
Take
Cheers.
care.